the Institute for the Study of Peak States presents the second International Psychoimmunology and Psychobiology Research Symposium. Our journey to date and beyond, presented by Shayne McKenzie.
Okay, so in addition to being the CEO for the Institute, I'm also one of the 4 certified trainers around the world, and I'm the clinic director where I help deliver some of the clinic treatments around Asperger's syndrome, Lyme disease, obsessive compulsive disorder, traumatic brain injury, and I'm also involved in quite a lot of the research projects, including type 1 diabetes and autism, which I'm hoping fairly soon we might have them as clinic processes in the future, which would be great. What I wanted to do here in the next kind of 15 minutes or so is just give you a little bit of background from an institute perspective as to how we've got to a framework and a model for being able to develop treatments for diseases using a psychoimmunology approach. It's been a journey for over 20 years to get to this point. And so now that we're at this point, what we are hoping might be able to be achievable going forward. So the Institute for the Study of Peak States is predominantly a research organisation. That was the primary reason why Grant set up the Institute in 1999. And in setting that up, as I'd mentioned, they're all volunteer researchers. You know, they got degrees in science or medicine or psychology, and didn't necessarily plan this, but in focusing on trying to solve some pretty challenging problems around, you know, how do we get peak states of consciousness? How do we come up with treatments to resolve diseases? It ended up becoming very much a biology-based model. And as part of testing that research, firstly, the research staff would test it on themselves, firstly for safety, make sure there's no overreactions, but then start to find, initially if we've got research staff with the issue that we're actually looking to research, but then later on, we also then train people in our techniques so that they could also become part of our safety testing as well. So we do have a training group as well. All of the trainers are long-term staff, you know, real commitment to the organisation. They spend a lot of their time doing research as well, and clinic treatments and independent therapy as well. So they're highly committed to this work, real experienced trainers and very effective as therapists as well. And our training process also has a certification process to make sure that those that do get trained in our work and want to deliver this kind of work, that they understand the theory and they've demonstrated that they can practically apply it properly with clients. Then we've got a number of clinic treatments. So I briefly mentioned those before: Asperger's syndrome, Lyme disease, obsessive compulsive disorder, and traumatic brain injury are probably the 4 key ones that we have at the moment. And we're hoping with the research we're doing at the moment that the number of treatments we'll be delivering in the clinic will significantly grow over the short term. And then we have a number of independent therapists who are being trained in our models, but work in their own practices, some part-time, some full-time, either doing trauma therapy or helping clients get into peak states of consciousness. So we're a global organisation. We have 36 staff, 52 certified therapists all around the world in 18 different countries. So to do the math, while we're quite broad across many different countries, there's not many certified therapists in each country. So on average, there's only a few certified therapists in each country, and delivering our therapy in 11 different languages. So all this started because of our founder and co-director of research, Dr. Grant McFedridge. He's got an engineering degree in Stanford University, which has come in handy because he's actually thought about these problems from very much an engineering perspective rather than a a conventional medicine or psychology perspective. And that's really helped. He taught engineering at California State University. He's got a PhD in psychology, given that this was the field that he realised that his life path took him on. Established the Institute in '99, and he's the author of many books. So his journey kind of started because he had a pretty amazing peak state of consciousness that Native Americans call Beauty Way. So probably around 15 years old, really was starting to think about, how can he actually help others with kind of a course out in nature that he did. And then this amazing state that he had, he actually lost when he was 29 years old, with, I guess, trauma happening after getting divorced. And so that kind of started the process that ended up becoming establishing the Institute around how to get that peak state back. Now, ironically, he still hasn't figured out how to get that beauty way state back, but along the way has developed a significant number of amazing research breakthroughs. So the foundation for all of the work that we do is trauma therapy. So at this stage, the Institute wasn't formally created, but Grant was, it started the journey around trying to figure out peak states of consciousness and other issues. And the small number of people he was working with at the time, the key thing they were really focusing on was how to get highly effective and I guess simple and stable trauma therapy techniques. And one of the key breakthroughs at this time was that the origin of biographical trauma actually starts with a prenatal injury. So this is very different to the conventional psychology view that would probably more likely say early childhood trauma is what contributes to psychological issues that people might have or traumas that they're experiencing later on. And while there's a number of traumas that are linked, and one of those might include a childhood trauma, it actually, that whole link of traumas that have the same symptoms, so the same emotions or physical sensations, actually originated with a prenatal injury. And so given that was the case, it was really important to develop an effective trauma healing technique that was good at healing prenatal injury. And so developed a treatment to be able to do that. And not only was there biographical trauma that they were healing using this technique, also healing generational trauma, so traumas that have been inherited from our parents and ancestors before that, as well as body associations, so kind of illogical associations where at an unconscious level we want to hold on to negative things that don't make sense, or not actually have kind of more positive things in our life because of the negative associations that we have. So as I said, Grant and the research team developed this regression technique that we call wholehearted healing. And that became a primary research tool, continually going back to various different prenatal events that we call key developmental events, and healing trauma events and seeing what kind of changes were happening out of that. So in the case of biographical trauma, regressing back to that originating prenatal trauma and healing that completely, or in the case of generational trauma, actually regressing back to the original ancestor where that started, which nowadays would be called epigenetics. So that process and some other things, other trauma therapy techniques were published in the Basic Wholehearted Healing Manual. So then the next kind of key breakthrough was around what we call these key developmental events. And this is where starting to focus much more on, one of those key questions that Grant started with was around how is it that people have peak states of consciousness? So we went out kind of studying quite a number of things, talking to spiritual leaders and religious leaders and people doing shamanic work, and trying to figure out why was it people were doing the practices that they were doing to get the peak states that they ended up with, and discovering that they were not all looking for the one peak state. And then he ended up identifying probably observing about 100 peak states and has classified about 50 peak states that have been on our website, that are listed on our website. So examples here, so this is what we then call developmental psychobiology. So this was predictably being able to go back to the same key developmental event for everyone. And the key breakthrough here was understanding that it wasn't a particular practice or a particular virtuous life that you were leading that got you into a peak state. It was actually that you had to have a trauma-free moment in these key developmental events that were prenatal to be able to have that peak state. And so from this, published a couple of books around Peak States of Consciousness, Volume 1, not only what he found with his own practice, but also what other researchers and were finding around different approaches to getting peak states of consciousness. And then in Volume 2, a lot of the work that he did in his PhD in psychology is in that book. So what this meant now is because it was the same key developmental event that had to be trauma-free for everyone, you then had a standard process that could actually get you into particular states, such as inner peace or silent mind. So we actually do have an old version of our inner peace process on our YouTube channel, so anyone can actually go there. We have updated that process. Back then, maybe 1 in 3 people could just follow those instructions in that YouTube channel and get into the inner peace state, whereas now with our updated process, there's a much higher effectiveness rate. So then the next big breakthrough was what we call, or what Grant called, the primary cell. So this kind of came out of some work that Grant was doing where he was trying to find, really focusing on trying to solve this problem, doing lots of meditation and acupuncture, and in this sweat lodge, all of a sudden, became aware of what looked like a spiritual experience, seeing lots of images that weren't kind of physically there, but clearly could see these images. And it actually took him and his colleague about a year to figure out that what they were actually seeing was something inside the primary cell. And so this basically created a whole new science, I guess, that we call subcellular psychobiology. And so some of the things that came out of this was, one, while there's a number of very effective trauma healing techniques, some of the things aren't what we call simple trauma. So they're not just biographical trauma or generational trauma or body associations. There's some structural issues that are happening in the primary cell that don't respond to just the simple trauma healing approach. And so an example is something that we call a copy, where if you use a simple trauma healing technique on it, it's not actually going to disappear. Or a time loop, which might bring a trauma back. It also explained spiritual experiences, because one of the things Grant wanted to have was this unifying holistic model that explained psychological experiences, spiritual and shamanic experiences, diseases. So to be able to explain all of those things, and things like there is a structure in this primary cell that looks like a macabre. And so that would explain why some people would have that experience. And then also over time discovered that there were subcellular pathogens, which were definitely impacting the state of health of just about all of humanity and other mammals as well. And so once the research team had done enough testing to kind of get the right balance between wanting to get this information out to the world, but also potential safety issues around that, released the book Subcellular Psychobiology Diagnosis Handbook that explained what some of these subcellular cases were. And so the way this actually works is the research team would go back and regress either on a biographical trauma to the originating trauma or generational trauma. But now, not only are we healing something in the past, we're now able to observe what's actually happening in the primary cell in the present, because this is where our consciousness actually resides. And so the things that are improving in our primary cell, the healthier that primary cell becomes, the healthier we are overall. And the good thing is that the way that we're able to have therapists diagnose for this is that what's happening in the primary cells superimposing over the body. So the emotions and physical sensations are able to be used as ways to diagnose what kind of subcellular case it is. And then you can choose the right protocol that'll actually address that and get to the root cause of the problem. And so then finally, and just in the last few years, a key breakthrough was around understanding fluids from the pathogen are very similar to fluids from these from key developmental events. And this is part of the reason why we, at an unconscious level, think we actually need to hold on to these. And so this is kind of re-energize the field of psychoimmunology. And this is one of the things we really want to share and hope that others can be doing more research in this field as well. So at the moment, we've got a treatment for Lyme disease and obsessive compulsive disorder using this approach. And Grant and Kirsten are in the process of writing a psychoimmunology design handbook that we hope will be out in the next year or two, but we're not sure. They can quite often take quite a bit of time to write a new book. And so as far as where we hope to go through from here, so as I said, Lyme disease and OCD are current treatments. We've got current research around COVID-19, type 1 diabetes and smoking addiction, and you'll hear about those presentations tomorrow. And then there's also other research areas. We just listed just a handful just to give you an example. So multiple sclerosis, we've kind of touched on that in the past, but we haven't looked at it from a psychoimmunology approach. We'd love to come up with treatments for things like Parkinson's disease. Alzheimer's or dementia is something we've touched on in the past as well. So there's many, many applications that we could be using, and we hope we're able to come up with some successful treatments using this approach. And I briefly mentioned that we selected 9 of our certified therapists and we've been training them in the psychoimmunology design approach to hopefully achieve that goal we have to find new ways to heal humanity.
Thank you for watching. For more information, visit pigstates.com.